parietal cortices in 1 minute or less. So the parietal cortex is where, again, you're getting information from all the senses, your auditory, visual, somatosensory, coming in here to establish and maintain a sense of spatial relationships of things relative to you in the outside world. And so, for instance, if you were not this drill sergeant here, not this guy who's being tutored, but rather this guy in the red arrow, if he's looking front and center, where is his spatial attention at this time? Do you think his spatial attention's on the wall where he's looking over here? Heck no. His spatial attention is right here on what this drill sergeant is doing to make sure he's not next to be tutored here. And the areas of the brain shown in the green and yellow are part of the spatial attention network. So you got these superior parietal regions and some of this motor cortical regions here. So he is sensing what's out there in space. Where is it in space? Even though he's not looking directly at it, right? It could be separated from where you're looking as to what you're attending to. But this network is critical, this frontal parietal network for spatial attention network, your spotlight of attention. Where are you attending in space, regardless of vision, auditory, or tactile? You can have lesions. Here's a large right lesion leading to called spatial neglect or parietal neglect. So the left parietal lobe represents your right hemifield of space where you're seeing and hearing out there and tactile feeling. Your right parietal cortex is representing, it has left and right, it has a little bit of both representations. It's more dominant for spatial orienting. So if you have right parietal damage, there is no part of your brain that can now deal with the left side of your space. And so someone with right parietal damage will be ignoring the right side of their space. They may fail to shave the left side of their body. They may not dress the left side of their body. They may not leap from the left side of a plate. And these are some classic examples of someone to here draw a clock. They draw the clock, they completely ignore the left side. Draw the picture of this house, they ignore most of the left side of the house. Bisect this line into 2 equal halves, they're way off due to this parietal neglect. And Gerstman syndrome is what you associate with that. So if you want to, okay, everybody put your hand out and scratch your head like this. Good, so you have the willful intent to go and scratch your head. Now, if you had someone with a lesion taking out in the brown here, you may have that lose that ability to send the information, that intent to make that movement to go and scratch your head when I asked you to do that. However, if you had an itch on your head, you might want to just go and scratch it just reflexively. So the motor planning to make that motor movement is intact, but the willful act to intend to and have that happen can be disrupted.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.